We really just wanted to get right down to it and figure out what is the process, what is it that we're talking about, the American Health Care Act, what does it mean? What does it mean for the Affordable Care Act? And I wanted to start with you, Chris. Just tell us a little bit. You almost literally live on Capitol Hill and you spend a great deal of time there. Tell us about the process and the procedures and everything that's going on right now.
Yeah, it's an interesting process and a crazy one, to say the least. And there's so much noise out there, right? There's so much headlines that you see and so much speculation and so much rhetoric and discussion on one side as well as the other. And I really like to personally, when I talk to clients or I talk to an audience like this, to really kind of cut through the noise and try to explain, what the process is and kind of why we are where we are. When it comes to process, right, there are two ways that you can repeal and replace the ACA. The first way is through the normal legislative process. Now, through the normal legislative process, you need 60 votes in the Senate to pass any piece of legislation. Republicans right now only have 52 seats. They're not about to get 8 Democrats to join them in repealing and replacing the ACA, so you're not going to be able to repeal and replace the ACA through the normal legislative process. There's another option, however, and it's called the reconciliation process. And I'm sure that you've heard this word, you might have read an explanation of it through some print media, or you might have heard some explanations over some of the TV, different talk shows. In short, the reconciliation process does allow legislation to be passed by just 51 votes. So the 60-vote threshold that I mentioned is not applicable. But in order to get the luxury, as I like to refer to it, of getting this 51-vote threshold for passage of legislation, there's conditions and there's constraints on what can be included in this underlying legislation. And those conditions are the provisions can only impact spending and they can only impact taxes. And now that's a really important piece of information for everybody to understand, because it tells you that only portions of the ACA can be repealed and replaced through this reconciliation process: taxes and spending. And again, that's really important to understand, because while the taxes, like the Cadillac tax, will be impacted, the employer mandate will be repealed, the individual mandate will be repealed, the contribution limit on FSAs, all of the taxes under the ACA can be repealed. Also, spending side, Medicaid expansion, the premium subsidies in the individual market, that can be repealed as well. But guess what cannot be repealed? The insurance market reforms. So reforms like the pre-X prohibition, the coverage of adult children up to age 26, the no cost sharing for preventive service, the no annual and lifetime limits. All of those provisions that apply to group health plans, for example, will not be repealed through this recent reconciliation process that Republicans are trying to pass their legislation through.